decided to come in and fast him. He fasted for a week, normalized his abdominal function. 3 months later, was still normal. A year later, 2 years later, the man still, this is a decade ago, still has his appendix. So if you're interested in the work that we do and knowing whether fasting might be relevant to you, we have a free service that you might want to take advantage of. You can go to our website at truenorthhealth.com, fill out the medical questionnaire form, and we call it the registration form, and I'll review your medical history for no cost and talk to you with a free phone conversation to try to point you into the right direction. We have a number of doctors that do telemedicine that work with people all over the world. We have a facility that you can come and do medically supervised fasting at, and we can refer you to other people that might be of some use. And again, there's no cost for that. You just go to our website at truenorthhealth.com. That website also has access to our lectures. You can freely access our educational program remotely. We live stream a lot of the work that we do, and you can access the doctors. We have a bunch of doctors that are not idiots. It's really, I know, novel and unique, and they can help you. We have a Roku channel where you can get access to large amounts of content with no cost. We've got books that we've published. The Bravo Express Cookbook and Health Promoting Cookbook are all vegan SOS-free cookbooks that are simple enough. Even I can make the recipes and they taste great. We have 2 books, The Pleasure Trap and our newest book, Can Fasting Save Your Life? Most of the material that I've presented you today is all represented here in Can Fasting Save Your Life? And, you know, what I'd like to do now is give you a chance to ask any questions. I know there's been some questions that have been written in, and take a break and try to answer your questions properly.
Great. Thank you so much, Dr. Goldhamer. Really appreciate all the information. And that you shared how everyone can reach out to you. I signed up for your newsletter so I can sign up for that study that you'll be doing in the future. So I look
Excellent. Yeah, well, at some point we have to lock you up and put you through the fasting process, because it'll be a real epiphany experience for you.
I would okay. Yeah, I would love it. I actually did a 5-day fast. I guess it's been about 5 years ago. And one of the things, and I know you're supposed to rest, and I planned on being exhausted and resting during this 5-day fast. And the weird thing was
high energy.
I was not only high energy, I was hyper productive.
Yes.
Everything I had on my to-do list, like that had been lingering for like 5 years of like, oh, I really want it done. I just cleared out everything. I had such mental acuity and clarity. It was shocking.
I gotta say, I have a guy that only works when he's fasting. He doesn't work the rest of the year, but every year or so he'll come in and do a fast, and during that time he writes a screenplay. And so he's a screenplay writer, but he can only do it in the fasting state. And so even though I don't recommend that from a health standpoint, working when you're fasting, but he goes on the fast, he writes, and some of the movies you've seen, were written while he was fasting here at True North Health Center. So it's like, it's really kind of a remarkable thing. And again, I don't recommend people write screenplays when they're fasting, but you're right. People get really clear and focused, and a lot of creativity comes up, and it's a very interesting process that people go through when they're fasting.
Well, I look forward to that. So now how about home fasting with remote consulting? Can you talk about?
So we have doctors that specialize in that. One of the things, though, you do need to have a local doctor help you in terms of being able to get lab and be available if there's issues that come up. But we do have doctors that can help you fast remotely. The screening will let you know, are you a candidate for that? Not everybody is a candidate for remote fasting. Sometimes their medical conditions are too complicated to do that remotely. Sometimes people are not good candidates for fasting. They shouldn't be fasting. There's a different approach. But for people that are good candidates for fasting, we do have doctors that can help you do that safely and effectively. There are some limitations, the duration of fasting, the type of, how it's done sometimes has to be modulated so it can be done safely, but we can help you determine that. And if you're going to fast, do it right and have a good outcome. Don't screw it up and make fasting look bad. That's all I ask.
So I think I did the fasting right when I did it. And I tried to do the refeeding right. I was insatiable afterwards, and for a long period of time, and to the point where it became unproductive. What are the refeeding tricks that you suggest?
Yes. So
fast.
it's very important that fasting refeeding be done properly. It takes half the length of the fast on average to go through controlled refeeding. So a 20-day fast takes about 10 days of programmed refeeding. And we have a very specific protocol that people need to follow so that they don't get into those issues of insatiation. And we in our book, Can Fasting Save Your Life, all of this is laid out. It's all the information a person would need and all the information their doctor would need to help them get through this process safely and effectively. We get into explaining how some of the cravings people have in general, and particularly after fasting, have to do with insulin levels and blood glucose. People that eat refined carbohydrates, the blood sugar goes up, insulin goes up, it drives the sugar down, your brain thinks you're starving, now you're having binging and craving. Once you get on a whole plant food SOS-free diet and you're stabilized, you find you're way less vulnerable to that types of binging and craving and all that other stuff because blood sugar levels stabilize, insulin levels stabilize. But for people that are too active in fasting or people that come off the fast too aggressively, they can get themselves into trouble. So I'm not saying fasting can't be done safely and effectively at home for some people, but you really do get yourself educated before you do it because you can make a mess of it. I get calls every week from people in trouble because they did foolish things during fasting. They didn't take a look at what we've learned the hard way in terms of advising people to do fasting safely and effectively. At the very least, read Can Fasting Save Your Life? So you're familiar with we've spent 50 years learning this stuff. You can learn it all in a few hours reading the book. So get yourself educated if you're going to use fasting so you use it well.
Great, thank you. So one of the participants is asking, why isn't every doctor, every medical school, every medical journalist investigating these results?
Well, I mean, you don't want to hear the answer, really. I can tell you, we approached an HMO recently trying to do a study with them. We were willing to completely fund it, just use their subjects to compare the treatment of high blood pressure. We're also interested in looking at lymphoma. And even the research folks at this HMO said, look, we don't question that it's safe and that it's effective. We see the data there, but we don't see any way that we can scale it and make money. And so therefore, we're not interested.
They said that to you outright?
Absolutely frank and honest that if they can't scale it and make money on it, there's no point in them investigating it. In fact, they won't investigate it because if they do it and it works, they're kind of obligated to make the therapy available. But if that therapy is not a lucrative therapy, then it's not going to be happening.
Okay, well, that's scary and part and parcel for everything we
Oh,
hear.
it gets worse.
Oh, okay, we'd have to
I mean,
continue.
so the point is right now, people don't appreciate the fact that many of the decisions that are made in medicine in terms of what care you're getting are economically driven, not necessarily patient interest driven. So there's a lot of concern, and unfortunately, it's also infiltrated the research aspects of medicine as well. It's not just the clinicians that are making these economically driven. I'll give you an example. Many physicians make tons of money because they run infusion centers for treating cancer and for treating autoimmune disease. But people don't understand that those doctors are paid for the drugs they infuse. So the more they give, the higher the doses, the more people they infuse, the more money they make. So they're financially disincentivized for investigating anything that might reduce people's need for these chemotherapeutic agents. They don't understand that that's a huge influencing factor. Same thing with medical devices, that, in terms of what choices are being made can be profoundly influenced by financial issues. What drugs are prescribed can be profoundly influenced financially by the reward system that's inherent in the medical profession today. So the more you look into it, the more disgusting and concerning it becomes.
Wow. When someone's fasting, what are typical detox symptoms that they can expect?
Fasting can be a rather intense, sometimes a miserable process, depending on how toxic people are. If you prep well, though, if you limit yourself to exclusively whole plant fruits and vegetables, steamed and starchy vegetables only before the fast, the intensity of the detoxification can be greatly eliminated. For example, it's nasty coming off caffeine. Caffeine withdrawal give headaches, can be very distressing. And if you try to do that at the same time you're fasting, it can be overwhelming for people. But if you get people to wean down off their toxic waste before they fast, it makes the transition to fasting dramatically easier. What I call less entertaining, because the really intense healing crises are much less in people that do a good preparatory job, or people that have fasted before, they've already kicked those enzyme systems in. They usually are what we call boring because they just go on the fast and get well. The really entertainment comes in people that are coming off of lots of meds and don't prep well, and they really have a much more interesting time. We try to have as boring a fasting experience as possible for people, but I have to admit, sometimes I like the challenge of, some of the excitement that comes up when people, don't follow our advice beforehand.
Well, if I may, just and not to go too long into this, but what was one of the most interesting stories you had with regard to an entertaining fast?
Oh, I mean, literally, there are hundreds of stories that we could tell you, but what I can tell you is here's what happens typically to people. First of all, the mouth will cut up and taste like something crawled in there and died. A really foul taste in the mouth, particularly for people that are coming off meat, fish, fowl, eggs, dairy products, and highly processed food. So it lasts a few days and then it clears. Low back pain as the kidneys are working overtime, processing a lot of the active metabolic products. People are oftentimes diuresing, so they lose 2, 3, 4, 5, even more pounds of these fluids that are coming off. And so they spend a lot of time urinating. If they get up too quickly, as their blood pressure normalizes, they're not used to having normal blood pressure, so they can get dizzy or have orthostasis. So we have to teach people to move slowly and be careful. It's easy to see people dehydrate if they get out in the sun too much or they're just too active. And so that can be rather distressing. Vivid dreams. Oh my gosh, especially for people coming up that have a history of medications or with recreational drugs. They'll have these really intense dreams. And that can be rather interesting. Irritability. So also sometimes they detox so much that they have stuff coming out of their mucous membranes and odors. They don't even want to be in the same room with themselves, during periods of time. And then that'll all go away. And then new things show up. You can see, I've seen people where they've had old injuries, they have an ankle, and during the fast, even though they don't injure it, it'll swell up and get really active, and then the body will resolve it, and they won't have the crepitus and problems that they used to have before fasting. Fasting is so interesting. The doctors we have at the center, the chiropractors, osteopaths, the therapists, often say you better treat people before they fast, because after they're done fasting, there may be nothing left to work on because so many things correct themselves. And if you want to try to take credit for something, you got to get to it before the body heals itself. So fasting is a very interesting, rather intense process. But, we're still here 40 years later. And many of our patients, do periodic fasting every year or two. They'll come in and they'll do fasting, not just to get well, but to stay well. And in fact, we looked at one of the studies I didn't talk about was what happened to healthy people. But the impact on cardiometabolic factors in healthy people was actually higher than in sick people. The people that may get the most benefit of all are going to turn out to be the healthy people that use shorter fasting preventatively so that they don't get sick. And that's the topic of our Navigator study that we're going to be setting up now, where we enroll people for the rest of their life. And we track, can we avoid the last 20 years of debility by getting people to eat a whole plant food diet, exercising, sleeping, and periodically doing preventative fasting, whether it's 12 hours every day or a week or two every year. And so we're going to be looking at that in great detail to find out what the best combination of factors are to ensure that a person has a good life, and then they have a good death where they go to bed and don't wake up and don't spend the last 20 years of their life unable to talk or move, lying in some nursing home bed waiting for people to change their diaper because they had a stroke or heart attack that should have been prevented.
Wow. And how long or how often should someone who's healthy do a fast? And how
Well,
long
we believe that everybody should fast every day for between 12 and 16 hours. And that what we're doing right now is once a year in healthy people, doing a week of fasting. If they continue to be stable, that's it. If they have symptoms, then we would fast longer. But many people that think they're, quote, healthy aren't actually healthy. You find out their blood pressure's a little too high, their cholesterol's a little too high, their inflammatory markers are elevated. They've got some problems that they take as normal but aren't normal. They've got some osteoarthritis, they've got some issues. Maybe they're on some medications. And so for truly healthy people, we believe that even a periodic fast of a week or two is going to be enough to be able to maintain health. We'll learn more with the Navigator study. That's one of the questions we'll be looking. If we did it twice a year, would it work better than once a year? What we do in practice, what I do is once a year, I take time out for a fast. Now, I've been doing this for 50 years. I never had a cigarette or an alcoholic drink or whatever, because I've been doing this since I was a kid. I fast once a year. I hate fasting because I don't like having to rest. You can't play basketball. You got to take time out. But I do believe it's one of the most powerful things that you can do in order to sustain health. And I believe that healthy diet, sleep, and exercise are what you want to do if you want to make the last 20 years of your life the best instead of the worst years.
And as part of the Navigator study, is that something that people are going to be able to do from home, or are they going to have to come in to True North?
No, they'll have a choice. If they do their fasting at home, we'll make sure that they're doing it appropriately with remote support. If they come into the center, that's fine. We can do it at the center. We may also put on events once or twice a year around the country to make it easier for people to access to do these. But again, we'll give people all the different options, or some people may choose not to fast, and that's okay, because we're going to be able to compare then. Do the people that fast regularly do even better than the people that are doing everything else right, but not choosing to fast? And also the people that are not compliant will help us too, because let's say they go back to eating greasy, fatty, slimy, dead, decaying flesh processed foods. That's okay, because we'll be able to show, what happens to them long-term compared to the people that are compliant. So we're going to welcome everybody, no matter what they choose to do. The only requirement is that they honestly report on our forms every year what they're actually doing. So, whatever they're doing is fine, but we need them to actually fill out that there's some questionnaires and things that will be done electronically so that we can get accurate data, because we really want to know, what's the best advice, how strict you need to be, and can we completely eliminate a lot of the debility that most people are going to experience in the last couple of decades of their life. I can tell you I have strong suspicions, because I've got people now that are 40-year follow-ups with me. So I've been managing, they were in their 40s, now they're in their 80s or their 90s. And the story they keep telling me is the same. Everybody they know is dead. And even some of their kids are dead now. They've outlived their children, because their kids at 65 have a heart attack because they're not eating well. They're at 85 and they're still busy, sharp as tacks and engaging in productive activity. So, I always tell the story of my mom, who at 92 told me she had outlived all 50 of her lifelong friends. They all were dead. And she said it was getting to be a problem because it was harder and harder to make friends, because even people 10 or 15 years younger than her were still too old to do the stuff that she wanted to do. And, they spent all their time at doctors and pills and potions and whatever. And she said, Alan, you have to warn your patients that are going to do this kind of diet. Make younger friends. And she said, not just a little younger, a lot younger. And maybe pick out a couple that are health conscious so there'll be people left at the end.
Good advice. So, when are you planning on kicking off the registration process for that, just so people can keep an eye?
We'll notify everybody that's signs up for our free newsletter when we're ready to enroll. Right now, we're going through some technical things for setup. We're installing next week, actually, or 2 weeks, a very sophisticated electronic medical record system that we've done custom development on. It's been 2 years in development, and we spent a lot of money on it, but it's going to allow us to very efficiently collect, store, and data mine this data to make this study possible. We've also we've gotten some generous donations from benefactors who has helped us, so that we'll be able to incentivize people that are doing these studies and hopefully make it enticing enough that they'll want to take the extra time to fill out a few forms and do the stuff that we need to do every year to be able to participate in the study. So we're going to try to make it so attractive that we'll be able to enroll the 2,000 people that we're interested in doing, and we'll track them the rest of their life.
All right, awesome. And you mentioned this during the talk, but just if you could restate it, how long does it usually take for the palate to reboot?
Well, if you do it just with feeding, we know that data. It takes about a month to neuroadapt to a low salt diet, and it takes almost 3 months to neuroadapt to a low fat diet before you feel naturally satiated. And that's why adherence is so low, because you can't say to somebody, look, go on this diet, it'll taste like crap for a month. You will be uncomfortable, and just stick with it, and eventually it won't be so bad. That's not a really good pitch, okay? So with fasting, it happens much quicker. And what we were able to show is that even in the context of the time that people are at the center, they almost universally experience a profound change in their sensitivity to salt and sugar, and good foods start to taste good. Look at my union guy. He was as tough as it gets. Twice a day triple cheeseburger guy. By the time we were done, he was taking down the food and was quite comfortable with it.
And what's the shortest amount of time for a fast for it to reboot your palate?
Well, sometimes people don't even need their palate rebooted. Literally just doing the 12-hour a day, every day fast that they do on their own over time is enough to kind of kick it in. And they'll notice over days or weeks that good foods start to taste better. And then what we do is we get them to stop using salt, for example, cooked in the food, but put a little on the surface of the food, just back it off, wean it off, until eventually they realize they don't need to be poisoning themselves to enjoy their food.